so new and everyone's freaking out about it.
We don't know how to stay safe besides putting hand sanitizer and washing our hands and stuff like that. We don't know other precautions to take.
As the coronavirus spreads well beyond China, people are hungry for hard facts on the best way to protect themselves. And as we've seen, bogus information can be dangerous. It can raise needless fears or give people a false sense of security. So once again, we've gathered some of your questions to put to the health experts to try to bring you real answers that you can use. Dr. Colin Lee is a specialist in preventive medicine and infectious diseases. He's in Toronto this evening. And Dr. Kathleen Ross is president of Doctors of BC, and she's here with me in Vancouver. Dr. Ross, let me start with you, and a question we're getting from a lot of people. Lucia asked this particular one: mask versus no mask. What do you suggest?
Depends on the situation. So masks can contain large respiratory droplets that may have infectious material. When you place that mask on someone who is ill, they do very little to protect those in the public walking around unless they're in close contact with an infected person.
And what about eye protection?
Certainly, it is best if you're in close contact with a patient suspected of carrying a virus. Wearing eye protection in addition to a mask helps to protect those of us that are in close contact, and that applies to family members, but also frontline primary care providers that are taking swabs of nose or throat.
Dr. Lee, let me put this next question to you. It's from a viewer named Doug. He asks, do the airlines have a decontamination protocol for soft surfaces like seats and carpets and blankets on planes?
As far as I understand it, when a plane deplanes, they certainly clean the plane with some vacuuming, but certainly I wouldn't say it's a decontamination. I think your audience is wondering, can you get the coronavirus from sitting in a seat and getting the virus particles? I would say that, you should be taking precautions by making sure that you wash your hands even more frequently, because you'll be touching surfaces that other people would have touched. You can also bring some antiseptic wipes and wipe the hard surfaces like the table. But certainly the seats and the fabric, there's not much you can do about that. The virus does survive a number of hours, maybe a day, maybe 2 days on those seats.
And Dr. Lee, this is a different version of that implicit question about how long the virus can survive on surfaces. Francine asks whether she should be concerned about receiving a package in the mail from Wuhan, China.
There's no concern about that. The virus likely lasts a day, maybe 2 days on the surface, so the chances of picking something up on a package that you receive from Wuhan, there's a bigger chance that you're going to get virus particles from your friendly mail delivery person. And just like anything else, after you open your package, make sure you wash your hands and before you touch your nose and face, and you'll be good.
And I guess to clarify, the potential virus transmission from the person delivering the mail, you're not referring to the new coronavirus, but basically any of those many viruses that are floating around in society at any time. Dr. Ross, let me put this question to you from Sandy. She says apparently passengers arriving from China are only being asked if they visited Wuhan in the last 14 days and if they had a fever. Is that effective screening?
I think for the moment that's reasonable. I'd like to reiterate that the risk to Canadians is low, and we had some experience with advanced screening during the SARS epidemic that resulted in a very expensive process for border guards and did not identify any additional cases.
And Dr. Lee, here's a question from April. How many people who have died from the coronavirus were otherwise healthy people? How much do we know about that?
I don't think we know the exact numbers, but we do know that the majority of people who have unfortunately succumbed to the illness have had some medical conditions as well as our older adults. Unfortunately, that kind of information that we're seeking is not readily available, but I think that the coronavirus likely behaves like any other virus in that it tends to affect the elderly and persons with more medical conditions.
And it's notable, I talked about this on the National on Friday, but it bears repeating. 4 confirmed cases in Canada, none of the 4 in hospital at this point, and the youngest in her 20s had what were described as relatively mild symptoms. This next question is from Kevin. I'm going to put it to both of you, but maybe start with Dr. Ross. Advice on how to lessen the probability that I or my family would become infected.
I would give patients the same advice as I would to all patients during the cold and flu season. Make sure that you wash your hands well with soap and water for at least 20 seconds before you touch your mouth or your nose. Wash your hands before you prepare or eat food. Ensure that you cough into your elbow and try to avoid close contact with those who are ill.
I don't think I have too much to add to that. I think it's the same way that we would approach not getting a cold or the flu. And I think for those few Canadians that are arriving back from the areas of concern, I think the most important thing is if you do develop a cough, a fever, or become short of breath, don't rush to the clinic, don't rush to go see someone. Give a call to public health, give a call to telehealth, give a call to your healthcare provider, tell them about the issue, and listen to their advice on what to do next.
Dr. Lee, I guess a general question from me. I see on the one hand, headlines like global health emergency, epidemic, these dire concerns that people have, the number of people who have died in China. And so there is a real sense of anxiety among a lot of people that I'm talking to here in Canada. What would you say to people who are anxious about the risk they feel they have from this virus?
I mean, this is a new disease. It is affecting a lot of people. Thankfully for Canadians at this time, it is affecting largely people in China. We have a real possibility right now to contain the virus. We've only had 4 cases. We've had no community transmission, and this is our job. The job we're doing right now is to contain the virus here. If it does get here, it has. We've been able to contain it. We haven't seen it transmitted to another person who hasn't traveled. And this is the goal right now. The next couple of weeks will be telling.
And Dr. Ross, in your practice, you're seeing people, and also in your position, not just patients, but physicians as well, you're saying to me that are very anxious about what's happening here. What do you say to them?
I think that we have to have good public health and hygiene practices, both personally and professionally. We are very grateful, those of us standing on the front line, for the continuous updates from our medical health officers and the CDC, and we hugely appreciate the 24/7 advice that's available to us when we speak to ill patients or when we see them. The other point that I have been emphasizing to my patients is to ensure that your vaccines are up to date. If you had your flu vaccine this year, if you're eligible, have you had your pneumonia vaccine? Are your children's vaccines primary series up to date? This also counts as prevention.
All right, Dr. Ross, Dr. Lee, thank you very much for coming in and sharing your expertise with us.
Thank you.
Thank you.
So, of course, those are just some of your questions. As this story develops in the coming days and months, we'll keep trying to answer them. So keep sending us questions, thoughts, issues, complaints by email. Just send it to thenational@cbc.ca.